Hello, and welcome to Module 6 of the Introduction to Mentalization-Based Treatment. So this is the final module in this program, and this is where we focus on the diagnoses of emotionally unstable personality disorder. So first of all, just to note that some people might have heard of the diagnoses borderline personality disorder. And these two diagnoses are really quite interchangeable. The reason we have these two different terms is that borderline personality disorder is the label that is given in something called the DSM, which is the Diagnostic and Statistical Manual, and that's something that's used in America when looking at diagnoses. So it has categories and ideas in that manual. Now in Europe and in the international community, so the rest of the world, the manual used to look at diagnoses is something called the ICD-10. So that's the International Classification of Disease. And again, in that, it's a classification of all the different types of illnesses and different categories. So if you've heard of borderline personality disorder or emotionally unstable personality disorder, really we're looking at the same kind of difficulties. So that's just to note that. And secondly, I think it's really important to highlight how difficult it can be for people when they are given this diagnosis. People have often talked about it feeling like it's quite a stigmatizing diagnosis, and it's a sort of kind of getting to the core of them, like their personality, so it can feel quite as if it's really quite attacking something on a personal level. And then how other people perceive it, and what we're hoping to do in this module is really to start to unpick what do we really mean by this. So for some people, working their way through these modules might have been referred into our service because they have already been given this diagnosis. They might have been given some understanding about that diagnosis, and they've found their way into a treatment which has got an extremely good evidence base, which is the mentalization-based treatment for this specific diagnosis. Now, for others, they might not have ever heard of this, or they might have heard of it, but they're now wondering why they've been sent this particular program to work through. And really, I would say that if that's the case, then it's really about thinking about all the modules that you've gone through and seeing if there are things within those modules that you're starting to identify with. And by completing this final module, if there is even more sort of evidence or information that's starting to help you make sense of your difficulties. So what we can find, although for some people it can feel quite stigmatizing, for others, when they've come to our service and we've helped them understand and we've really explored and teased out what we mean by this diagnosis, it's actually felt as if they've finally landed somewhere where they feel they're being understood. And this can offer some relief actually for some people, that to put a name or a label onto what can sometimes feel like a lifetime of difficulties and develop some understanding about how that might have come about, how that might have developed. And then to also think about how that can change and how with treatment and engaging together, and working through and understanding that things can be different. So I invite you to keep an open mind when we're thinking about the personality disorder, and just to see if any of the information resonates with you. So before we go on to explore a bit more the diagnoses of an emotionally unstable personality disorder, let's just take a moment to think about what do we mean by personality. So we all have personalities. It's a combination of our characteristics, the sort of qualities that we all have. So these can be a mixture of different things when we start to think about them. People can sometimes talk about somebody being quite an extrovert. So that would imply that they're sort of quite confident, outspoken, might enjoy being the centre of things. The other side to that, the opposite, might be someone who's introverted. So they're more reserved, possibly quite quiet, might enjoy being in their own company a bit more. Other characteristics might be things like someone's quite charismatic. So that implies that they have qualities that sort of entice people to get to know them, that there's something about them that people find interesting. Or someone could be conscientious, so that they take on things and they follow through. They can be very reliable in attending to certain things. Maybe someone's quite agreeable, which would imply that they're sort of maybe find a balance and try and go for a sort of middle way. So these are some examples of what might be individual characteristics or qualities within a particular person's personality. So I'd like to invite you to just have a moment's reflection and just think about yourself, and just try and think about how you might describe yourself to another person. And also, how would somebody else, what do others see in you? What might others notice? What makes you an individual? What makes you you? And are you different with the different kinds of relationships? So in a more close and intimate relationship, might you reveal certain parts to your personality that you might not with a work colleague? So which of these features, when you sort of have a little think about your own personality, are the features that you quite like about yourself? So just have a few moments and think about that. So I think it's really important to start by highlighting, as we explore the ideas around personality disorder and unhelpful traits, that this doesn't mean that there aren't any positive traits for people who might have this diagnosis, and that there can be many aspects to our personality. So as I was saying, many positive traits. We can have many talents, can be very resourceful and resilient, but there can be these unhelpful traits which seem to trip us up as we're trying to get through life. And those unhelpful traits are maybe the aspects which are preventing us from sort of having our full potential and really achieving in the areas of our lives that we want to. And so this is an opportunity to start to focus in on those and to think, what do we mean by these unhelpful personality traits? And they tend to get grouped into these sort of 4 kind of areas. So the unhelpful traits we often start by thinking around is our thoughts, our thinking. And if I can take you back to those first modules around mentalizing, when we really explored how important it is for our sort of general well-being, this idea about being able to maintain this reflective, mentalizing capacity. And now we all have that, but we all lose it. And so the thinking part, which can be unhelpful here, is maybe when we lose that capacity to maintain that mentalizing stance. So that might be around, say, ways in which we might feel very certain about what others' thoughts are. That we might feel as if we know what's going on in their minds. So something like, I knew she never liked me. She couldn't even bear to look at me when she walked in. So there's a real certainty in that. There's not being able to maintain a more open mind and stay quite curious and try and think about if what your experiences, your thoughts are actually what's actually going on for the other. There's this other sort of way in which our thinking can occur as well, which is often referred to as black and white thinking. So when we're talking about black and white thinking, we're really talking about how things can feel either very right or very wrong. So they can be sort of divided into sort of absolutes and quite often quite extremes. Or somebody's thinking can just feel as if they're all negative about themselves even. So again, another example might be something like, oh, that's just typical of me that I forgot it was going to be my son's birthday. I'm just such a useless mother. In fact, I'm an idiot and I deserve to be punished. So everything there is, it's very weighted towards being very negative. So this is this kind of idea around this black and white thinking. So another area is our feelings. And again, if I could get you to cast your minds back to the mentalizing slides, that was where we thought about how when we get very emotionally aroused, we have that switch point, and then we lose our capacity to mentalize. So again, these are very interconnected. So these feelings and these emotions that might be experienced that can feel extreme will also impact on our mentalizing and on the ways in which we're reflecting on situations. So people have described an idea with their feeling states to me as if they feel as if they're on a roller coaster ride. So their emotions can be so interchangeable. And we're not talking from week to week or month to month. People have described feeling, going from having intense anger to anxiety to joy to feeling happy to feeling extremely sad. And that can all be in the course of a few hours. So there's this constant fluctuation in feeling states. So feeling extremely unstable. And then when we looked at those emotions and feelings back in module 3, and we talked about how people might try and regulate feelings and might sort of have some quite impulsive behaviours or some unhelpful behaviours. So that was when we were thinking about how people might self-harm or might use drugs and alcohol, or all those other areas that we looked at. So this can be a way in which people try to get some regulation into their emotional states. But as we noted, these can be very problematic. And although they might offer a little bit of respite in the moment, that the long-term impacts can be very detrimental. And And then the other is how those three, if we think about the thinking patterns and the way in which we might have our thinking, and that those emotions and how intense they can feel, and how we then have this impulsive behavior, all of those can then have a real impact on how we're relating to other people. So that interpersonal aspect, how we're able to maintain and sustain our relationships. So if things are constantly fluctuating and changing for us internally, that this can then have a significant impact in how we maintain our relationships, but also how we relate to other people and how we experience them being with us. So these very difficult and complex ways and these traits can have quite an impact on somebody's self-esteem and their self-image. One of the aspects to this diagnosis can be about a person not feeling a sense of who they are, sort of not knowing who they are, and consequently trying to be what they think other people want them to be or expect them to be, but without having any sense of who that is for themselves. And that whole way of trying to operate by trying to constantly be what you think the other person wants you to be, or not really knowing who you are, can feel sort of very exhausting. But it can also leave people feeling as if they don't really fit in or connect with others, because they have no idea of who they are. And if they're constantly trying to be a person who they think other people want them to be, that this really can stop them from really sort of developing that sense of themselves. And this way of relating and being with others, and this low self-esteem and these particular personality traits that we've been describing, they usually impact in all aspects of somebody's life. If they're on the more severe sort of continuum of this sort of diagnoses, so they can be across from when you're from adolescence, maybe earlier, much earlier for some. So they can be impacted on school and how you develop friendships and relationships early on in life. They can impact on work and finding jobs and sustaining jobs. And because of all the problems around the emotional instability, there can be a real impact on work life and things like that. And also on family life, on our relationships, as I was saying before. There can be real difficulties in how others are perceiving us and how we're perceiving others. So there can be a real impact on these areas of our lives, which are significant in our overall emotional well-being. But it just states here again, and I want to really draw your attention to it, that personality disorder does not affect the entire personality. And something else to really hold in your mind is that these traits and these ways of being have often been a way of surviving. So they've been helpful at times, but now they're becoming problematic. And they are changeable. And so over time, things can change. And once we get a better understanding of what the difficulties are and where we want to get to, then that can really help us think about what we might need to change. And this mentalizing and really developing that skill and understanding our emotions is absolutely key in making these changes. So here, this is just a few examples of some of the personality traits that sort of might trip you up. There are many others. So this, as I say, it's just a snapshot of some possibilities. And I suppose if we look at these and we think about what we've been discussing in the previous slides, we can see how these would sort of get in the way in us trying to sort of find our way in the world, really. So if we've had experiences where the world can be perceived as a very threatening place, it might be one that's been in the past full of fearful situations, might have led to us feeling very isolated, feeling very lonely, not feeling that our needs are being met. And there might be a number of those aspects that relate to some of these personality traits. So if we've really struggled with intense feelings in managing our anger, we might have found ourselves withdrawing from relationships or from being in certain situations where we felt that was triggered as a way of coping. And although it's been possibly a solution to managing those intense feelings, it's maybe prevented us from then actually being able to do the things that we want to do. If there's been sort of that sort of struggling with our impulse control, again, these can feel very difficult to be managing. So certain coping strategies might have been activated to try and manage that, but that might again have meant that we've had to retreat and withdraw from situations. So as I say, this is just something to look at, and you might see some of these and think, yes, I relate to some of those, just to try and start to explore a bit more about your own personality traits. And that's really what I'm going to invite you to do again here. So at the beginning of this module, we thought about our personality just in a general sense, and I hope you were able to find some sort of likable and positive aspects to your personality, although some people in the groups do say they struggle with that. But here I just want to invite you to take a moment to reflect about some of the personality traits that might trip you up in life. So those traits that really seem to get in the way of you getting what you want. Just try and think of a couple of examples of those. And then the other side to that, think about the personality traits that help you get what you want in life. So those ones that you can sort of identify and think, well, you know, that aspect of my personality means that I do get my needs met. I can get my voice heard. So just try and spend a few moments in trying to think about those two aspects. So these next two slides really are sort of, I suppose, just summarising and bringing into focus a bit more about the traits that we often see in people who have a diagnosis of emotionally unstable personality disorder. And it's this idea that we've had from the beginning, really from when we thought about attachment, about worrying about abandonment. So that comes from our insecure attachment, and how people might try to do anything. So stay in some very problematic relationships at times where they might be being sort of mistreated, but this fear of abandonment or being left is such that you know, they will do anything to stop that happening. These intense emotions that can last for hours or days and then can change quickly and constantly. So really not really having a sense of any stability in our emotional states. That sense of not really feeling you know who you are. So not really feeling secure, and a sense of that, which can really impact on your overall confidence and self-esteem, the way you are in situations. Really struggling to maintain any kind of stable relationship, a real desire to want that, and then things keep happening that really sort of prevent that from happening. There can be this feeling of an emptiness, and people describe sometimes feeling as if it's a sort of internally just feeling like nothing gives them any fulfillment, that they just feel so empty. And this can be connected to people who have maybe had very difficult and traumatic experiences of having long-standing neglect, maybe early on in life. Other aspects that we've focused on and looked at is this impulsivity, and that can often lead to some very self-harming behaviours, which can be very risky and very dangerous, but do offer some respite and alleviation in that moment from some emotional distress. This can also lead to ongoing sort of suicidal thoughts, and at times acting on those. As we've mentioned, that the intense feelings, and people have spoke to this intense feeling of anger, which at times can feel extremely difficult to control, and if it doesn't get sort of acted on in a way of trying to manage that, and people have described sort of smashing up flats, or sort of, you know, at times even hurting others. But they can also take that anger inwards. So to prevent them from hurting another, they can end up really harming themselves, and sort of trying to manage it that way. And when extremely distressed, some of that thinking, some of those thought patterns can also lead to what we might call some more paranoid thinking. So very heightened states of that suspiciousness, really sort of feeling as if people are there, they're sort of really out to get you. So this can have lapses in our reality testing, these paranoid ideas. It can even result in feeling as though people are watching you. Or people have described at times having a sense of hearing sort of voices, but these are not what we would describe as a more sort of psychotic nature, and they dissipate very quickly over time. So they can be quite contextual. They can happen in a moment, in a certain context, but they're not happening continuously. Or this idea of disassociation as well. Some of you might be sort of thinking that why are we thinking about this in terms of emotionally unstable personality disorder, which can feel, as I said before, very stigmatizing as a type of diagnosis. And often now you might have come across or heard about complex post-traumatic stress disorder. And complex trauma really has many features, and is very similar when we look at that, and we look at it, emotionally unstable personality disorder. And in fact, when there's been studies looking at people who have this diagnosis, emotionally unstable personality disorder, it sort of roughly approximately shows that 70% of people have experienced some sort of trauma. So this is a very sort of common feature to people who have got a diagnosis of emotionally unstable personality disorder. And it's very high in the sense that that's nearly 14 times more likely for somebody with this diagnosis to have reported a childhood trauma than people without the diagnoses. So having a diagnosis of emotionally unstable personality disorder doesn't mean that you wouldn't also possibly have other diagnoses. So diagnoses that run alongside, so that we call comorbid. So people have often talked about depression and anxiety, and these are features of emotionally unstable personality disorder. People might become quite anxious at times, but they might also have anxiety disorder. And likewise, due to the traumatic events that have occurred, they might also have post-traumatic stress disorder. So these are not an either or. It can be a very complex picture, and people can have aspects of all of those sorts of diagnoses. And I suppose with the mentalization-based treatment, which is the treatment that people often can go on to after they've completed this introductory treatment, um, it's trauma informed in the sense that we absolutely understand that those traumatic experiences, be them in our early lives or later on in life or both, will have had a significant impact on how we are in the here and now. So we've come to the end of the 6 modules now, and here we are with our final task. What we spend time doing in our final session is to get people to review over the other modules, and you can go back and look over the videos if you like, to just then try and look at the formulation sheet which we sent alongside with all the other outcome measures, and that sheet really just gets you to focus in and think a little bit about, are there any particular areas that you feel you need to focus on when you think about those different modules? So around your mentalizing, emotions, your distress tolerance, and thinking about attachment patterns in particular maybe as well. So if you can just think about those areas, and what do you identify as your sort of main difficulties? The sort of, there may be many, but if you just focus in on some of the key difficulties and what you would really like to focus a therapy on in order to sort of see a difference in your life, some changes you'd like to make. So that could take you some time. Some people write more than others. So I don't want you to feel too pressurized. It can just be bullet points, short answers, just indicators, or some people prefer to write something a bit more detailed. It's entirely up to you. Now, once you've completed the formulation sheet, there's also those other outcome measures that we gave you at the beginning of the process, before we sort of sent you the video link. And if you could just repeat those, and there's alongside those, there's also a questionnaire, because we don't normally do these modules online. So we've just developed a sort of evaluation form, really, which we would really appreciate your views on how you found this, and if it's been helpful or not. And please, you can fill that in anonymously. You don't have to put your name on it, and that will just get collated over time, so that will help us evaluate these online modules. Once you've completed all those outcome measures and various documents, the email address there that's on your screen, if you could just send your forms to that email address, and then what will happen is that will alert your assessor that you have now completed this online program, and they will have a look at those. If you send the formulation as well, they will get a sense then of how they might want to focus their consultation with you. But they will contact you and invite you to a review consultation to look at, just to have a think about if the material resonated with you, if any of it really sort of made you think that this is an area you want to focus on. And then they will consider the various therapeutic options we have either in our services or in other services, but we'll try and think with you together about how best to move forward. If you do have any questions, you can always telephone us as well. We still have our phones manned, so you can call us on 0208 510 2900. That's 0208 510 2900 if you've got any queries or questions. And I'd just like to thank you for going through this process. Bye.